Today we're going to talk about heartburn, what it is, what causes it, things that you can do when you have it, as well as times to go to the doctor. What is heartburn? It's that burning feeling that you get in your chest. Oftentimes after you eat, you lie down or you bend over. Sometimes it's none of those feelings, but you wake up with like a sour or bitter taste in your mouth. Those are all possible symptoms of heartburn. To understand heartburn, you have to understand a little bit about the human body. And so let's talk about that. Here is my wonderful drawing. So let's just talk about the different parts. Here's the mouth where the food enters, the esophagus, the tube that the food travels down to the stomach. When the food goes into the stomach, the acid in the stomach causes the food to break down, which makes it easier for the rest of the body to absorb the nutrients that it needs. The acid in the stomach is pretty strong, and so there is something called the lower esophageal sphincter that keeps the acid in the stomach and keeps it from going up into the esophagus. What happens when you eat food is that the lower esophageal sphincter opens so that the food can come down the esophagus and into the stomach, and then it closes again. Sometimes, and what happens with heartburn is that the lower esophageal sphincter does not close. When the lower esophageal sphincter doesn't close, that's what causes the heartburn that we feel. As the acid comes up, it causes that sensation of burning, because literally the acid is burning the inside lining of the esophagus. We'll talk about what are some reasons why the lower esophageal sphincter does not close. What causes that lower esophageal sphincter to open and not close at the proper time? There are some foods that do that. Tomatoes, onions, spicy food, caffeinated foods like chocolate, coffee, tea, fatty foods, fried foods, oily foods, greasy foods, alcohol, smoking, citrus, things like oranges, lemons, peppermint. Other things that can cause heartburn to be worse are being overweight. That puts a lot more pressure on your belly and can push some of that acid up into your esophagus. Pregnancy can cause it as well for obvious reasons. What are some easy things you can do to help treat heartburn? They are to avoid those foods that we just talked about. Other things you can do is to not eat large fatty meals. Eat smaller meals instead. Also, don't lie down after you have a meal. Let gravity do its work. And so if you don't lie down for 2 to 3 hours after you eat, you're less likely to have heartburn. Some people still have heartburn when they lie down, and a thing that you can do is, again, let gravity help you. And so that is to elevate the head of your bed. Now, a lot of people like to put pillows under their bed, but when you do that, you're actually going to end up scrunching your stomach and pushing some of that acid up. So instead, what you want to do is actually elevate the head of your bed so you're lying at an angle. The good ways to do that are to either put books at the bottom of the head of your bed or bricks or something that will raise it. If you have access to a wedge, you can use that. Another thing you can do is avoid wearing really tight clothing around your belly. If you're overweight, lose weight. Obvious things would be to stop smoking and alcohol. In terms of medications that you can take, there's a lot of medications you could just buy over the counter, including antacids such as Tums, calcium carbonate. Other things that you can use are things called H2 blockers. A common kind is ranitidine, but you can ask your pharmacist what those would be. Other over-the-counter medications include proton pump inhibitors. These include omeprazole, pantoprazole. These are all things you can buy over the counter. If you do use medication, if you've used it for 2 weeks, I would recommend that you go see a doctor just in case there's something else going on. Also, some of these medications, if you use them long term, can cause health problems, and so it's important to talk to your doctor. So reasons to go see a doctor are if you're having heartburn despite taking the medication and it's been more than 2 weeks. If your heartburn occurs more than 2 times a week, if you're having blood in your stool, if you have problems swallowing, if you have nausea and vomiting, if you're losing weight, you have a poor appetite, or you have any difficulty eating. So I hope that helps. For more information, watch the rest of our Save H1 health and safety videos.